What's up, guys? This is Dr. Kyle from Cape Chiropractic and Acupuncture coming at you with this week's movement tip of the week. This week we're going to talk about the bird dog, which is a really common low back stabilizing exercise, and the 3 most common errors I see during the performance in the clinic. So before we start, I just want to show you what a nice clean repetition of the bird dog looks like and explain why it's so important. So we've talked before about stability in the spine, and this exercise is a great way to enhance the stability of the spine while teaching you how to move around stability with your shoulders and your hips. So a nice properly executed bird dog, you have your hands underneath your shoulders, you have your knees underneath your hips, similar to the cat camel like we talked about a few weeks ago. What you're going to do is actually start with just a gentle few rounds of flexion and extension to find that happy neutral zone in your spine. Once you find that, there should be no pain. From here, you start by bracing in the anterior core, creating a nice abdominal brace. I like to use the cue of pretending like a little baby is going to try and punch you in the stomach. It should be about a 10 to 20% contraction. Next, what you're going to do is you're going to start by keeping that anterior core nice and tight. You're going to extend your leg, and you're going to extend the opposite arm while trying to maintain your spine in the same position. Okay, so again, this is teaching us how to move. I'm going to kick the door here. About our spine using our hips and our shoulders. So some of the most common errors I see in this movement, especially when trying to cue this in the clinic, is number 1, people will start in a nice position, but as soon as they go into the extension position or flexion with the shoulder and extension in the hip, they dip in their mid back or their low back. And one of the biggest errors is that they don't maintain that abdominal brace. So one cue I use is, again, use that baby punching you in the belly to keep that anterior core nice and stable. The next cue I use is pretend like there's a glass on your pelvis, a glass of water, glass of wine, glass of coffee, whatever it is. And you don't want that glass to spill on your back as you're doing this. So again, a nice stable repetition would be like this, okay? The next thing I see is actually easier to see in this angle here. It's a hip hike, or people tend to go into this motion and open up a hip like this to try and compensate because they're not able to maintain that good stability within the pelvis, okay? So again, if you pretend like there's a glass on your pelvis right here and you were going to go into a hip hike like this and open up to try and do this, you'd be spilling. So again, try and keep nice anterior core stabilization, and it's the slower you go, the more exaggerated and difficult it becomes, but also will help you create that true stability. Now the last thing is from this angle here. People tend to not achieve true hip extension by using their glutes. They typically will try and achieve or cheat hip extension by either extending through the back like this, like we just talked about, but secondly, they'll try and recruit through hamstring or use this muscle here to try and achieve that extension. So they'll kind of bend their leg like this, and oftentimes you'll see that hyperextension in the low back at the same time. So a good cue for this one is to pretend like you're dorsiflexing or bringing your foot up this way, bringing your toes towards your knee and pushing your heel straight back. When you push your heel, drive your heel straight back, it encourages the glute to fire and you're getting true hip extension here. You should feel a nice contraction in your butt as you're doing this movement. Now, as you do this, you want to hold it for about 8 to 10 seconds on each side to create a nice isometric contraction on either side. Try this for about 8 to 10 repetitions. It's a great exercise for people who have just gotten out of an acute episode of low back pain, or for people who are just trying to create some stability and activation before a nice workout. Thanks for your time, guys, and we'll see you next week.